So we're going to talk about the neurocutaneous syndromes, aka phacomatoses. I still, I was looking at the BCSC. I didn't realize that they were classifying IP or incontinentia pigmenti as a neurocutaneous syndrome. So anyway, it's not in this presentation. But for this, I think you guys already know some about every one of these, neurocutaneous syndromes. We've been hearing about them since medical school. But I think a lot of times when we get the information at first, it's like you hear about NF1 and these are all the things about NF1, or you hear about, Sturge-Weber and these are all the things about Sturge-Weber. So I think one thing that really helps on tests when you're looking at a picture and you're like, what disease is this, is, comparing and contrasting like all the different diseases and seeing how they're similar and different. So I just wanted to start off with, what you guys think in terms of how the phacomatoses are similar to each other. So what do kind of all the phacomatoses have in common, or many of them have in common?
Skin findings.
Yeah.
Yeah, so the neurocutaneous, meaning that they affect the brain or nervous system, we'll say, which includes the eye, as well as the skin. Okay, what else do they have in common?
A lot have vascular lesions.
Yeah, vascular lesions. So actually, I'm going to classify the neurocutaneous syndromes as like vascular and non-vascular. Cool. What kind of lesions are the typical lesions in neurocutaneous syndromes? Are they cancers? Are they, what are they?
They're usually benign proliferation, so like a hamartoma.
Yeah, so a hamartoma, benign proliferation. And what's the definition of a hamartoma, like compared to a choristoma?
It's a proliferation of tissue, a benign proliferation of tissue of like normal tissue that usually isn't in that anatomic region, versus a choristoma, which is usually in that anatomic region.
I think it's
actually it's the opposite.
Oh, dang it.
You did it. You explained it really well. But hamartomas are tissues, proliferation of tissues that are normally present.
Normal. Okay, awesome.
One of our attendings said that maybe Dr. Zog said they remember hamartomas are home.
Oh, I like that.
Okay, nice. Yeah, I'll just give a disclaimer here that I like cannot learn by mnemonics, so I don't have any good mnemonics, but thankfully Dr. Zog and you guys, can fill us in on anything good you have to share.
That's good, Eileen. That just means that you actually understand things.
No, it just means that I have a really bad memory. So.
He knows all the Greek and Latin.
Yeah.
Okay, so what else do the phacomatoses have in common? What do you think about their inheritance, or what genes cause them, or?
Most are autosomal dominant.
And in terms of, you said like other parts of genetics, is some of them are tumor suppressor genes.
Yeah, very good. And speaking of like Greek and Latin, do you know like what phacomatoses are, or what is phaco? What does that like root mean? We know phaco a lot because we do phaco. Basically, the whole goal of residency is to turn you into a good phacoemulsification surgeon.
Is it like epithelium? Is it like skin? I'm not sure actually.
Yeah,
or ectoderm.
That's a good guess because like the birthmarks are on the skin. So actually, let me clear this out and then hopefully advance my slide. Oh no! Hold on. Okay. Oh no! Oh no! I thought I could advance. Okay. All right. Oh, I know. It was just because I had the Zoom window selected and not the.
Oh yeah.
Not the PowerPoint selected. So okay, I was panicking unnecessarily. So phaco actually means lentil. So I have a picture here of like a green and a red lentil. So that's why, like in the lens of the eye, when you eat that up with the ultrasound, it's called phacoemulsification. But the lentils actually kind of, they're flat, so they kind of look like a spot. So basically, phaco can mean, a birthmark. So anyway, phaco. fake oma, where a tumor is, oma is a tumor. So the other thing, I think you guys did really great in terms of, covering the things that they have in common. The only things that I would add is that they often present in childhood and young adulthood. But some of these findings, they're not necessarily present at birth. They kind of pop up, sometime during childhood, et cetera. And then the other thing that I would add is, why do you think that, or what is like, I guess, a rational explanation for why so many of these diseases are autosomal dominant? I like how I called it autosomal dominance.
Well, it's actually kind of not intuitive with the tumor suppressor gene. It's, I think it's reasonable because these patients live to adulthood, but I'm not sure why they're dominant.
What do you think about like retinoblastoma, which isn't a phakomatosis, but it's also a mutation in a tumor suppressor gene that's passed down in an autosomal dominant manner? What happens in RB? Like, because they inherited the gene, so they have a bad copy of the RB gene everywhere in their body, but they're not born with the tumors everywhere,
By two hit hypothesis, there's a second mutation that occurs sporadically.
Yeah, so I think the way I think of it is that in retinoblastoma, you have one bad copy everywhere. If by chance, during growth or development, as your body's making new cells, you lose that second copy, then your cells start proliferating abnormally. So that's how I kind of think of, the phakomatoses as being autosomal dominant too, is that they're also, they have one bad copy of the tumor suppressor gene, and maybe they're losing a second copy. I don't know that for sure, but that's how I rationalize it in my brain. Does that make sense?
Mm-hmm.
Okay, so we talked about hamartomas and chorostomas. Chorostomas being proliferations that are benign, but that of tumors that are not normally present at that site. And by malformations, we mean, there's some sort of defect in development. So another word that commonly comes up in these, vascular tumors that come from the neurocutaneous syndromes are angiomas. So angioma is the same word as hemangioma. It means the same thing, which is a proliferation of blood vessels. I think one of the really confusing things about the blood vessel tumors in the phakomatoses is that they all have so many different names that mean the same thing. So, but maybe it can be a little bit better if you just equate angioma and hemangioma like in your mind. So there's, capillary hemangiomas, which are, have thin-walled capillaries and scant stroma. And this is a hamartoma. Whereas there's also a hemangioblastoma. So blast, meaning like a kind of like primitive cell. So they're, they're less mature. So they're more capable of like, replicating aggressively and, growing fast and causing problems. So a hemangioblastoma has both capillaries, these reddish areas, as well as these neoplastic stromal cells that have all these vacuoles in them. So what condition is associated with retinal hemangioblastomas?
Von Hippel-Lindau.
Yeah, great, awesome. You guys are rocking it already with all the vascular tumors. So yeah, the hemangioblastoma is what occurs in von Hippel-Lindau, but has many other names, but that we'll go over in a second. So a racemose hemangioma, confusingly enough, is not actually a hemangioma. It's just an arteriovenous malformation, meaning an abnormal connection between arteries and veins. So if they if they wanted to confuse you further, now I've really done it. So, all right. So let's start off by naming all the syndromes, and I kind of like decide to sort them into non-blood vessel and blood vessel ones. So.
For non-blood vessel, like NF1 and 2.
Yep.
And then tuberous sclerosis.
Yep, great. Doing great.
And then we had von Hippel-Lindau VHL for the blood vessel hamartoma. And then
Weber.
Great.
Wyburn Mason.
Great. There's one that affects the conjunctiva.
Oh, ataxia telangiectasia.
Yeah.
And then there's one, I feel like when I looked before, you know, it was in the BCSC somewhere, but I didn't see it when I looked most recently. CCM, cavernous malformation.
Do I have that in my notes? Let me just see.
Anyway, I don't worry about studying that for the test. I just included it here to like
Okay, cool.
be more complete. I can't remember if it's in the BCSC or not, but it clearly does not play a prominent role there where I couldn't find it. Okay. So what are the, you know, some of these, I think the non-blood vessel ones, you know, they're mostly known by their, you know, English names, whereas the blood vessel ones are known mostly by their eponyms. What are the other names for these syndromes?
Oh shoot.
One is von Recklinghausen.
Yeah.
I
was like, I should at least attempt to spell it. Because, you know, like, yeah, it definitely comes up on tests. Like,
yeah,
they like to, you know.
Yeah, they like to put the other name, the one that it's like not as known by.
Yeah.
I think
yeah.
I randomly know that ataxia telangiectasia is like Louis Barr or Louis Barr.
Okay, yeah, it depends if Louis was French or not, I guess.
Wyburn Mason is, I mean, isn't that like Racemose still? Or
Yep. Racemose. I shouldn't do this, and then everyone knows how badly I type. Okay. All right. How about Sturge Weber? That one always tripped me up. That
like encephalo.
Yeah.
Facial something.
I know there's a trigeminal, but then I can't remember what comes next. But that's enough to get by on a test. So
it's
what is it?
Encephalomalacial angiomatosis.
Oh, okay. Excellent. Okay. With VHL, I saw retinal angiomatosis in places, but I don't think I saw it when I looked at the BCSC last, so I wouldn't worry too much about that. How about tuberous sclerosis? Okay. All right. I'm gonna try to clear my annotations and then go back to PowerPoint. All right. So, oh, I didn't, I guess there's another name for the Sturge Weber, cerebrofacial angiomatosis, as well as the encephalomalacial angiomatosis. And then what was?
Well, remember angiomatosis.
I feel like there's like they all have angiomatosis.
Oh, dang
I feel like there's also the encephalo. Anyway, what was I gonna say? The word trigeminal. I've seen that somewhere too. But anyway.
Oh yeah, tuberous sclerosis Bourneville. I always forget that one too.
Yeah, and then the NF2 is multiple inherited schwannomas, meningiomas, ependiomas. Okay, great job. All right, so let's describe the genetics. What's the inheritance of all these non-blood vessel hamartomas?
It's autosomal dominant, and the gene is NF1 on chromosome 17.
Yay!
I have a mnemonic for that. It's because von Recklinghausen and I think neurofibromatosis. Anyway, it's 17 letters.
Oh, very nice. How about NF2?
Autosomal dominant NF2 on
Yeah.
chromosome
Right.
22.
Yeah.
Yay. Yeah. Very good. That's like the only chromosome I remember is NF2
Yeah.
because it's like 2 and 2. Okay. How about tuberous sclerosis? What are the genes there? If you were to make something up, what would you make up?
It's TS something.
Yes, very good.
Oh,
It's
nice.
TSC
Okay.
I think it's TSC 1 and 2. Maybe there's an L in there. I don't recall. Okay, and then how about the inheritance of these blood vessel hamartomas? Let's start with Sturge-Weber.
Is that sporadic?
Yep, that's sporadic. And how about von Hippel-Lindau?
That's VHL.
Dominant.
Very good, excellent. Oh yeah, let me ask you the gene for Sturge-Weber.
Oh, I do not know.
It's GNAC. So even though it's not passed down, it's like during, development, probably in utero, one of your cells like mutates that GNAC gene. And just part of your body has it, like this side of your head, for example. Don't ask me why it's never passed down. I did look into that once, but I don't recall. And then how about Wyburn-Mason?
Sporadic.
Yeah. And cerebral cavernous malformations, that's dominant. And then how about Louis Barr? I don't know.
It's autosomal recessive.
Yeah, excellent, great, wonderful. And then how about the gene for Louis Barr?
I have no idea.
Okay, it's ATM.
Oh, okay.
Yeah. Okay, so great job. Oh yeah, I forgot there was another name for the NF2 gene, which I feel like I might have seen, on tests. It's Merlin. So that's the gene product, the protein. Okay, and then cerebral cavernous malformation, just so you know, is CCM1. All right, so we're just going to get into the pictures. Since Catherine gave me the feedback that I need more. She's a visual learner. So
I did?
yeah, I need more.
Sorry.
Pictures. So we're just going to start off with pictures. So what is this picture of?
Axillary freckling.
Yeah, great. And what condition is that found in?
NF1.
Excellent. Great. How about this one? What condition is this?
These are cafe au lait spots.
Yep.
Also an F1.
Great. And then how about these?
Those are ash leaf spots.
Yep. And what condition is that found in?
Is that tuberous? Okay, yeah, tuberous sclerosis.
Great. Wonderful. Tuberous sclerosis. And how about this one?
It might also be tuberous sclerosis with, I know that there are facial lesions that kind of look like this. I know that there are skin lesions called like,
The angiofibromas.
Mm-hmm.
Yeah,
that's right. That, they do get angiofibromas in tuberous sclerosis.
Are these neurofibromas?
Yeah, these are neurofibromas. So they're kind of proliferations of, nerve type of tissue under the skin. How about this one?
this is
port wine stain.
Yep. What's the other name for a port wine stain?
This is probably trigeminal something.
Yeah.
Probably. I know that there's nevus spontaneous. Maybe that are, yeah, I don't know. I gotta review that. Next version we'll have more of the Sturge-Weber words. Okay. And then how about this? What do you think this is trying to illustrate?
The like S-shaped plexiform neurofibroma.
Yep. And what's that found in?
Is that NF1?
I think it's mostly NF1.
What's NF1?
I'm guessing it could be an NF2, but I'm not sure. And then, so Ariana mentioned the skin lesions on the face that are little blood vessel tumors, I guess. What is the name for this? Or what are some names? There's probably multiple names.
Angiofibromas.
Okay. And then there's also facial angiofibromas, and then there's also adenoma sebaceum, other word for it. And then what's this?
Shagreen patch.
Yeah. And what is the condition in which this is like most commonly found or most associated with? Yep, tuberous sclerosis. If you really want to get into it, apparently it's present in some of the other lesions, but syndromes, but let's not get into it. Okay. All right. So let's just go through and name the skim findings of NF1.
So the neurofibromas, the like XS plexiform neurofibroma, the axillary freckling, cafe au lait spots.
Great. How about NF2?
You more rarely get cafe au lait spots.
Yeah. Yeah, things are just not as common to have skin findings in NF2. So we won't worry about memorizing those. At least I wouldn't. And then in tuberous sclerosis, what are the findings?
So it's the shagreen patch. And what do we call the white?
Oh, the ash leaf spots.
Yeah.
Okay, great.
Oh, and then the angio, is that the one with the angioma, the facial angiomas?
Okay, excellent. All right, how about the blood vessel hamartomas? We said this is the port wine stain for Sturge-Weber. How about VHL? Is there a major skin findings there? How about the rest of these guys? Are there major skin findings?
Can't think of any.
Yeah, so even though these are called like neurocutaneous syndromes, like the skin findings are really not that like major in a lot of these blood vessel hamartomas. Okay, so okay.
Nevus flammis, that's what it's called.
Yeah, good. And then the brain findings, how about those? We could start from the top again.
They have,
or we'll call the brain also the orbit.
Okay. They also have, they have hamartomas in there.
They have astrocytomas.
Yeah, that's what I meant.
What, in the brain?
Retina?
Yeah.
In the brain?
In the brain. And Catherine named before the eyelid.
Yeah.
Plexiform neurofibroma.
Oh, yeah. Wait. No. Yeah. And this is the one with like the optic pathway glioma.
Yeah, exactly. So these are, the optic nerve gliomas are pretty common enough, like in NF1, that they, recommend screening for them. And there's also absent greater wing of the sphenoid. Okay, how about NF2? It's the brain there.
They get the like cranial nerve 7, 8.
Yes, great. So bilateral acoustic neuromas. Great. And then how about tuberous sclerosis?
You get periventricular calcifications.
Yep, calcification. Sorry.
I think they get the retinal astrocytomas.
Yeah. Yeah, we'll focus on the eyeball.
Right. Oh, okay.
But yes, they do get retinal astrocytomas. What kind of drugs are tuberous sclerosis patients like always on? Or what drug are they always on that we have to keep seeing them for?
There's an anti-seizure drug that starts with a V.
Yeah, vigabatrin, very good. Yeah. And so these kids get a lot of seizures, and they can be really bad, and they can need these drugs like Phakomatoses, where we have to monitor, them to make sure they're not having any toxicity from that. Okay, let's see what happens in the brain with these blood vessel hamartomas. How about Sturge-Weber? So they get kind of like a meningeal blood vessel tumor. I'm sure there's a word for it a fancy word for that will come up soon. But they can have, like tram tracks, like subcortical calcification because of that, and atrophy of that part of their brain. How about von Hippel-Lindau? Yeah.
Yeah, it's some vascular lesion in the brain.
Yeah, definitely some vascular lesion from the brain. I'm so glad you said that, because that really actually captures like many of like all 4 of these.
Yeah.
So maybe we should just maybe let's just delete this, and then we could just call this like some vascular lesion in the brain for like all of these, really.
Yeah.
Okay, so, and then how about neurologically speaking, what does Lewis Barr patients get, or Louis Barr, or however you pronounce it?
Seizures and ataxia.
Yeah, good. Yeah, and that ataxia, telangiectasia, that is good there. Good to tell you what they have. Okay. All right. So let's see. We talked about these things. So yeah, it's called a meningeal angioma. They have calcium. Cerebellar hemangioma is the lesion in von Hippel-Lindau. The Wyburn-Mason, as we talked about, that racemose hemangioma is not actually an angioma, it's an arteriovenous malformation. And so just like they have an arteriovenous malformation in the retina, they tend to have them in the brain on the same side. And then as far as the cerebral cavernous malformation, they have a vascular cavernous malformation in the brain. And then the Lewis Barr patients can have motor deterioration. Okay, since I got rid of my animations, it's frankly labeled here in a very obvious way that this patient doesn't have a greater wing of the sphenoid on this side, as you can see here. And which syndrome is that present in?
NF1.
NF1. Great.
Oh, NF1. Okay.
Oh, I went backwards. Okay, and then this is a bilateral acoustic neuroma. Which disease is that present in?
NF2.
Yep, great. And then, so these are just pictures of the cortical tubers, which are apparently these like triangular whitish areas, or maybe it's this, maybe I think it's probably these black arrows, these triangular whitish areas, as well as the calcifications around the ventricles, which are subepidermal nodules, and these are called cortical tubers. The tubers are apparently areas where the neurons like migrated abnormally. And what disease is this?
Tuberous sclerosis.
Yeah, very good. Yeah, good. Yeah, tuberous sclerosis. I think tuber means like potatoes or something. I don't know, or roots, or I don't know. Anyway, this is a picture of arteriovenous malformation. I don't think they would like necessarily expect you to recognize this on site, but anyway, I don't know what's going on with that eyeball. Okay. And then this one is a picture of the meningeal angioma, which is, I guess, enhancing here on the right, and it's calcified, showing here on the left. And this is present in which condition? Do you think it's a blood vessel syndrome or a non-blood vessel syndrome?
It's blood vessel. Maybe you said Sturge-Weber?
Yep. Very good, Sturge-Weber. So they've got that thing on the surface of their face, And they've also got this thing on the surface of their brain, the angioma of the meninges. Here's a picture of a cerebellar hemangioblastoma. Which condition has hemangioblastomas of the retina?
VHL.
Yeah. And so they also have cerebellar hemangioblastomas. Okay, let's go on to the rest of the body. You guys are doing great. We covered the skin, we covered the brain. Now we just have the body and then the eyes. The body's pretty quick. Let's see, what other areas of the body, are affected in these syndromes, and what are they mostly affected by? Or what kind of, I guess generally speaking, what kind of lesions would they get in the rest of their body? Is it like a broken leg? Or
VHL affects the kidney.
Yeah. So they're hamartomas, or other tumors, that form elsewhere in the body. So yeah, very good. Yeah, VHL, they can get tumors in the kidney. What other condition can get kidney tumors?
Tuberous sclerosis.
Yes. So they get, in tuberous sclerosis, they get these renal angiomyolipomas. And then in NF1, they can get pheochromocytomas, which are not really on the kidneys, but they're on the adrenal glands right on top of the kidneys. The other unique things about tuberous sclerosis is the heart, the cardiac rhabdomyomas, and also the ungual fibromas on the fingernails. There's a variant of Sturge-Weber that is Klippel-Treune. Anyway, Weber. They both have Weber in there. And then these people with the Klippel-Treune or whatever have limb hypertrophy. And in Lewis-Barr, they can get frequent infections. Okay, so what's this a picture of?
The ungual neurofibroma, or not neurofibroma, ungual in tuberous sclerosis.
Yeah, ungual fibroma, excellent, tuberous sclerosis. And then which conditions cause pheochromocytomas?
You said NF1 does.
Yep, NF1.
VHL also?
Yep, and VHL. I'm just looking at this to check, make sure I'm saying it right. Yep. And then in VHL, they can also get renal, pancreatic, and hepatic cysts, as well as renal carcinoma. So how about the renal angiomyolipoma and the cardiac rhabdomyoma? Which disease affects the heart as well as the kidneys? That's tuberous sclerosis. So I listened to a lecture in preparation for this where they said you should remember that like tuberous sclerosis sounds like tuba, and you need a lot of muscles to like lift a tuba because it's really heavy, and therefore these tumors that are unique to tuberous sclerosis have the word myo or for muscle.
Oh.
Anyway, like I said, I usually don't do good with mnemonics, but that one annoyed me enough that it didn't make any sense that I remembered it. So. Okay, how about frequent infections? Which condition has frequent infections?
You said ataxia telangiectasia.
Great, which is also known as?
Lewy-Barr.
Great. Okay, is it Louis? Should I be saying Louis? Okay.
I don't know.
I should. Ariana's saying yes. Okay, I'll switch to saying Louis. Okay. Great. All right, so let's go on to the eye findings. Our favorite part. This is exciting. This is what we like actually get to see. So we could just start at the top again. How about NF1? We talked about the optic pathway gliomas.
Leash nodules.
Yep, great. How about NF2?
So you get PSC cataracts, cortical wedge cataracts.
I'll just put PSC on there because I feel like that's what most commonly I see on tests. And then what else do you get in the eye from NF2?
I do also get like retinal astrocytomas.
So you do get an issue on the retina, And what you get is a combined hemateratoma of the retina and RPE. Great. Yeah, now I'm getting excited because my favorite part of the eye is being discussed. Okay, how about tuberous sclerosis? What do you get in there?
That's the retinal astrocytomas.
Great. Awesome. And then how about Sturge-Weber?
You get the ketchup fundus
Mhm.
from a choroidal lesion.
What kind of choroidal lesion?
Hemangioma.
Okay. All right. Yep. Kind of a diffuse, choroidal hemangioma. And what in these patients, like, what are they really at risk for losing vision from?
Glaucoma.
Yeah. Interestingly, I was also reading in the BCSE that patients with plexiform neurofibromas in NF1 are also at high risk for glaucoma. Right. And then how about in VHL? What do they get?
The retinal hemangioblastoma.
Yeah, great. Thanks for using my favorite word for the tumors in VHL, hemangioblastoma. I think it's my favorite because it really distinguishes the fact that these tumors can be much more aggressive and grow faster. Unlike many of the hamartomas, in these other conditions, these hemangioblastomas are not just staying there, they're growing.
It seems the original Louis Barr paper was in French in the 1940s.
Oh,
nice.
Thank you. Thank you. Thank you for sharing. Unfortunately, we'll just have to leave the past 20 minutes or 30 minutes to be 40 minutes. Oh my gosh, we've been going for 40 minutes. You guys are really troopers. Okay. All right. So how about Louis Barr? What do we see in the eye?
The conjunctival telangiectasias.
Great. Okay, and then do you want to make a guess for in cerebral cavernous malformations, what happens in the eye?
Cavernous hemangioma.
We'll call it a retinal cavernous blank because I don't remember what comes after that. Because
and then for Weber Mason,
it's
the racemose angioma, which is the arterial venous malformation.
Yeah. Great. You guys are doing awesome with the eye findings. All right, let's clear this out and see what I said last night at 11:30. Okay. In NF1, they also get prominent corneal nerves and then multiple choroidal nevi, as well as myelinated nerve fiber layer. They can also get meningiomas of the optic nerve. Let's see. And then in tuberous sclerosis, the astrocytic hamartoma can happen on the nerve, as well as on the retina. And then, so here I put all the different names for the von Hippel-Lindau retinal lesions. My favorite is the retinal hemangioblastoma, but it gets called retinal capillary hemangioblastoma, angiomatosis retinae, retinal capillary hemangioma, and retinal angioma, just to confuse you.
Mm-hmm.
Okay. And then, you were right, Catherine. It's a retinal cavernous hemangioma.
Yeah.
Okay. Oh, and then Louis Barr, they get eye movement abnormalities. You can think of that going together with the ataxia.
That makes sense.
Okay. So we're going to look at some fundus photos. All right. Of course, this is a classic RetCam photo. It looks great on the screen of the RetCam, but then when you download it and try to use it anywhere else, it looks really terrible. But there's a grayish green lesion kind of emanating from the optic nerve there. Do you think it's a vascular lesion or non-vascular?
Vascular.
Okay, it's actually non-vascular lesion. But it's a terrible photo. This is probably typical what you might see on oral boards.
Yeah, or OCAPs.
On oral boards, I think there was a IOFB inside the anterior segment or something like that, but it looked like it was just a bad photo. Anyway. So this is the combined hamartoma of the retina and RPE, seen in which condition?
NF2.
Yep, great, NF2. All right, here's another picture. This is like a really bad ERM in a patient that has NF2. I think of maybe the ERM as being like a precursor to the combined hamartoma, where it's like kind of forming.
Like gliotic.
Yeah. And so this picture is supposed to illustrate multiple choroidal nevi. What condition is that?
The NF1?
Yep, great, awesome. And then here is another picture of like a grayish green lesion that's kind of like creating scarring and things pulled towards it. The other one was around the optic nerve, but this is the same thing.
Oh, the combined hamartoma.
Yeah, this is another combined hamartoma of the retina and RP. All right, and then how about this one that kind of looks like a mulberry sticking out of the optic nerve?
That looks like a astrocytoma.
Yep. Astrocytoma, also known as astrocytic hamartoma. In which condition?
Tuberous sclerosis.
Great, awesome. Okay, and how about these lesions? What do you make of those?
This is a retinal hemangioblastoma.
Right? I guess, are you saying that because there's blood vessels on it, or?
I guess, yeah.
Oh, okay. Yeah, I guess the photo is not really communicating it that well, but there are those little calcifications all on the top that look like a mulberry on this one, whereas this one's like more smooth. It just looks like the retina is like a little thickened there. So when I tell you that, what do you think this is?
More tuberous sclerosis hamartoma.
Yeah, these are astrocytic hamartomas. This is like the stage where it's got the calcification. This is like a flatter, more benign looking stage. Okay, and then what's this a picture of?
Myelinated nerve fiber layer.
Yep, and that's common in which condition?
NF1.
Great, awesome. You guys are passing with flying colors. Okay, now we just have the vascular lesions of the fundus. Okay, this is like another terrible photo. That might be like what you might see on oral boards.
This looks like ketchup fundus in Sturge-Weber.
Yeah, exactly. So a diffuse choroidal hemangioma. How about what kind of lesion do you think this is? This isn't what you would see in the neurocutaneous syndromes. I just threw it up for comparison to the last one.
It almost looks like retinoblastoma.
It is like more of a focal tumor, and it fills early with the choroid, and then washes out late. Or what is it called? There's a word for the washing out. But it's a choroidal hemangioma.
Oh, okay.
Where it washes out sooner and then it's darker than the rest of the fundus. I can't remember what the term is. But anyway, so this is a focal choroidal hemangioma, which can happen in anyone, in contrast to Sturge-Weber, where you get that diffuse choroidal hemangioma. So these like respond well, to PDT, whereas like the diffuse, you can't like PDT the entire fundus. So, yeah. All right, how about this lesion? This is a little vascular bump on the optic nerve.
Is that a hemangioblastoma?
Yeah, very good. Yeah, they tend to pop up on the optic nerve. Yeah, retinal capillary hemangioblastoma. Which condition does this occur in?
VHL.
Great, awesome.
It's like the only one I know.
Okay, how about this one? What's this one?
Is this the same thing? Like a retinal hemangioblastoma?
Yep, this is a retinal capillary hemangioblastoma. It just happens to be in the periphery rather than on the optic nerve, and it is in a VHL patient.
Yeah, I remember Chris Kamansky had a bunch of these photos and I would always get them wrong. So then I just like looked at a ton of them. And so now I think everything is a hemangioblastoma.
Well, I guess what we should be doing is like kind of linking this back to the rest of the body. So maybe, is there in VHL, are there characteristic skin findings? Not really. No. And then how about like the brain? What are the main findings of the brain?
You also get hemangioblastomas.
Great. Yeah, you get a cerebellar hemangioblastoma. Excellent. Okay, and then we talked about the VHL gene, and then it's autosomal dominant. We see these families where multiple of them have VHL. Anything else we should talk about with VHL? Did we talk about the
renal cell carcinoma? And
oh yeah, the rest of the body. Great. Yeah, renal cell carcinoma.
And
phagocytoma. Great. Awesome. And then, yeah, wonderful. And then I guess let's rewind and talk about Sturge-Weber. What's the inheritance of Sturge-Weber?
Autosomal dominant.
It's sporadic. So they just have the mutation just in this part of their head, not in their entire body, since they didn't get it from their parents. And then what do they get in the brain in Sturge-Weber?
The meningeal vascular malformation.
Yeah, great. Yeah, the meningeal angioma. So just like the surface of their face is affected, the surface of their brain is affected, and they can get seizures. Let's see. Is there anything else that we should talk about with Sturge-Weber? We talked about the Port Weinstein.
They're on that medication that we have to monitor for.
That's actually not Sturge-Weber. They do get seizures, but it's not as bad. Okay, but tell me about the other condition that we have to monitor because they're on the
tuberous sclerosis.
Yes, great, wonderful. So tuberous sclerosis, wonderful. But that's great that you're linking them together, right? That Sturge-Weber and tuberous sclerosis both have seizures, but and Sturge-Weber, they don't typically need to be on vigabatrin, so we don't have to see them regularly for monitoring. So tell me, I guess, since you brought up tuberous sclerosis, tell me what they get like in the rest of their body.
They get the tubers in the brain, like that you're seeing on MRI, those like kind of triangular shaped edges.
Right. Wonderful.
And then they get the ash leaf spots.
Great. What else do they get on their skin? Yeah, great. Awesome. Way to link that together. How about, what else do we say about tuberous sclerosis? We talked about the brain, the skin. How about the rest of the body? What do they get?
You get the cardiac and renal tumors as well.
Great. They get the tumors that have the word myo in the name. Awesome.
Tuba.
Yeah. And then the inheritance of tuberous sclerosis.
I get it now. I didn't understand that tuba sounds like tuberous sclerosis.
Like, why is Ariana smiling?
They have a heavy tuba, like a tuberous sclerosis.
Okay. How come you didn't get it earlier?
I thought that you were just talking about tubas and muscle, but now I understand that too.
Okay. Okay. Awesome. Okay. I'm glad you got it. Okay. Yes. But you remembered it anyway. The key features, despite not understanding the mnemonic. Okay, great. Oh, why is someone calling me? Okay, we'll just ignore them. Okay. So this grayish green thing with the terrible retcam photo, the combined hamartoma of the retina and RPE, that's characteristic of NF2. And then we talked about chromosome 22. How about let's talk about the brain in NF2?
The acoustic
Oh yeah.
Yep. Great. And they can also get schwannomas and meningiomas. Let's see. Was there anything with the rest of the body in NF2 that we should talk about?
No, I don't think so. I think they're mostly in NF1.
Yeah. Okay, good. And then let's see. Okay, so we covered that. And then how about we already talked about NF1 pretty thoroughly, I feel like. But just to review, cafe au lait spots, and then what else do they get on their skin?
The neurofibromas, the cutaneous
neurofibromas.
axillary freckling.
Axillary freckling. Oh yeah. So then, the freckling of the armpit, maybe it's kind of like the freckling of the eye. So you can link
Mhm.
them together that way. Okay, awesome. So back to looking at pictures. Okay, and this is a picture of what?
Racemose angioma.
Great, yeah. And so what's the inheritance of this?
Sporadic.
Great, awesome. And then do they get anything in their skin?
No.
Okay. And then what do they get in their brain?
AVMs.
Right, very good. Awesome. You guys are rocking it. And then was there anything else we should say about this? I don't think so.
There's like this, I think at Will's, somebody died from like a dental procedure or something. So they always ask like if they're at higher risk for like bleeding out from like jaw procedures.
Oh, they are. Because are they prone to getting them everywhere, not just in the brain and the eye? Is that
I think it's actually really rare, but because that patient happened at Will's, it's like a test question.
Okay. Okay. Well, thank you.
Catherine and I have not been bringing it up because that's how the story goes. So,
Yeah.
but not important.
Yeah.
Well, very important for tests. So, all right. Oh, here's another retinal capillary hemangioblastoma that's worse. It can like be really bad. Here's another one. I don't know. I have so many pictures of them. Here's another one. Okay.
Because they all look the same, or they all look like this like different thing. This.
Yeah. Anyway, so those are all the pictures. How about this one? What is this?
It's like is it a capillary a retinal capillary hemangioma?
This is a retinal cavernous hemangioma where I don't think that there are. Well, I guess a retinal capillary hemangioma is another word for a hemangioblastoma that you would see in VHL. Gotcha. So that so this is a cavernous one where there's really like dilated, those fat dilations. And with the fluorescein, there's this weird like pooling in the lower aspects of them. So this is the condition that I still don't know if it's in your BCSE or not. Because this can be associated with cavernous malformations of the brain. And I think, Dr. Katz was saying he like had a patient whose like, mother had died from a, hemorrhage in her brain from like cavernous malformation. So it is autosomal dominant, the CCM. I bet it'll make it into the BCSE eventually.
These pictures and like the retinal cavernous hemangioma is in the retina BCSE. I'm just looking at my notes, and then
it is,
and it says that it's autosomal dominant, but it doesn't, I don't think, refer to it as CCM. But
it's okay. Oh, great. Okay, that's where it is. Okay, awesome. You have amazing notes.
I just have this like one note and this one picture.
Is it this picture?
Yeah, it's like that picture.
Oh man, I need to replace this with like.
What was that?
Where did you say it's located?
It's located in the other retinal vascular disease chapter 7 in the retina BCSE.
Okay, I need to look at that
name, or it's different name in there.
No, it's like retinal cavernous hemangioma, and it shows, it's not this exact picture, but it's like it's like it's a very similar picture, and then it just says that it's sporadic in most cases or autosomal dominant, but it doesn't refer to like the CCM phakomatoses.
Oh yeah, and it doesn't refer to the fact that they need to be checked to make sure they don't have a big brain thing.
Not from my notes, but
okay. But that might be where I saw it, because I think I did see it somewhere in the BCSE. So, and I didn't look in the retinal chapter. So, okay. Here's another picture of a cavernous hemangioma, retinal cavernous hemangioma. We're making me worried though that you said that this exact picture is in the book, because I think I tend to, at least for the retinal photos, try to have them be photos that are new that you haven't seen before.
No, I don't think it's this exact one. I copied mine from the internet.
I don't keep track of whether I stole a photo or got an original photo. Okay, so how about this one? What lesion is this?
An optic nerve glioma.
Great. Awesome. And then what lesion is this?
Meningioma.
Great. And then tell me like how optic nerve gliomas and meningiomas are different.
Great question.
Well, a meningioma is going to be slow growing, and then you get like painless proptosis.
Mhm.
Glioma can be aggressive, and I think it depends on age, but I don't remember. I think maybe like kids, it's more likely to be aggressive.
Yeah, I guess maybe the gliomas are more likely to cause vision loss, but maybe not like necessarily like invade. Like I think they can grow, but maybe not. Yeah, not all the time. But and then so on the imaging, how do you distinguish the two?
Oh, the meningioma has like the train track appearance, and it's more of the proliferation of the meninges, so it's like outside the optic nerve.
Right.
Whereas like the glioma will look like the optic nerve itself is like, enlarging.
Yeah. And I think they say that there's like kinking and the glioma. And then what's the typical patient that gets an optic nerve meningioma? Like how old are they usually?
Middle age.
Yeah. And then you look like you're about to say something.
I was gonna say middle-aged woman.
Yeah, I think so. I think there's some sort of a mnemonic that it was like middle-aged woman and menopause or something. I don't know. Anyway, that doesn't sound right. Why would middle-age and menopause be in the same mnemonic? Because you don't need that. Okay. Anyway, yeah. Whereas gliomas, tend to be in kids. I don't know. I'm so far away from this. I was hoping you guys would come up with the meningioma versus glioma table, but
I think I've seen at least 2 patients, one actually an adult and one a child, who got enucleated
oh wow,
glioma,
wow.
but I don't think it always is that way.
All right, let's go on to anterior segment photos that are really terrible. What kind of cataract do you think this is trying to illustrate? I need to take a better photo.
PSC.
Excellent. And which disease is that?
NF2.
Great. And then how about this? What is this a picture of?
Could be leash nodules.
What else is going on with the iris?
Tropion uvea.
Great. And which condition is this?
NF1.
Okay. Are they born with these or?
No, they come in like teenage years.
Yeah. I'm not sure about coming when they're a teenager. It might be. I think it might be younger than that. But definitely, if you're trying to see someone when they're just born, to rule out NF, like you're not gonna see these. Oops, wrong.
Yeah, take that, primaries.
Why do you get those consults?
Yes.
For leash nodules?
Yes, we get the most ridiculous things.
Yeah. Anyway, what do you think I'm trying to? This is a picture of
enlarged corneal nerves.
Yeah. And then which condition?
NF1.
Great. Awesome. And then how about this?
Leash nodules?
Yep, just leash nodules on a blue-eyed person. Okay, that's all I have. You guys did an amazing, amazing job.